to help inform the public about the proactive steps we're taking to mitigate the spread of COVID-19. The situation continues to evolve rapidly. A short while ago, I joined other governors for a briefing with President Trump and Vice President Pence. On this call, I asked the President for more flexibility regarding telemedicine so Kansans can access a broader array of services in more locations. Additionally, I asked for flexibility for waiver approval from the Centers for Medicare and Medicaid to increase access to healthcare services for those on Medicaid. We have a few important updates to share this afternoon with the people of Kansas, including new CDC guidance and a new directive regarding utility disconnects. As many of you have likely read by now, immediately following last night's update, the Centers for Disease Control and Prevention issued new nationwide guidance recommending that all gatherings of more than 50 people be canceled or postponed for at least 8 weeks. Today, I'm announcing my executive order requiring Kansas to adopt the CDC's guidance immediately. This is an essential step to further encourage social distancing and stem the spread of the virus. I want you to know that we do not take this action lightly. Later today, I plan to meet with the Kansas Chamber of Commerce, the Kansas Restaurant and Hospitality Association, and the National Federation of Independent Businesses to discuss how the state can best support Kansas businesses and their employees as we navigate this unprecedented challenge together. As of now, numerous states have issued mandatory orders to limit public access to restaurants, bars, entertainment, and recreation facilities. Thankfully, many Kansas businesses and community organizations across the state have already taken difficult but necessary precautions in a proactive manner. I want to thank them for exercising responsible judgment and strongly urge all entities that have not taken these steps to begin to do so. Lastly, I have asked the Kansas Corporation Commission to suspend utility disconnects until April 15th. This morning, they announced this directive, which covers all electrical, natural gas, water, and telecommunications utilities under the KCC's jurisdiction, several of which had already voluntarily suspended disconnects. Additionally, I will be issuing an executive order immediately to stop utility disconnects for the companies outside the KCC jurisdiction. We must provide relief to our most vulnerable Kansans during these unprecedented times. We have heard the phrase flatten the curve often, and it is one I'd like to make sure everyone understands. When we slow the spread of the virus, we are flattening the curve. The steps we are taking are designed to flatten that curve and keep our communities safe. Certain populations are more vulnerable to COVID-19 than others, especially our seniors and those with underlying health conditions. But everyone has a role to play in keeping our communities safe. If we do not take this seriously, we endanger everyone. So while I love St. Patrick's Day as much as anyone, probably more than most, everyone needs to stay away from crowds as much as possible today, tomorrow, and in the weeks ahead. And again, Kansans, if you feel ill, do not go to work. Keep washing your hands and don't touch your face. And let me thank our local healthcare officials and providers who are on the front line of this effort. The best thing we can all do is follow their recommendations and stay up to date on developments and ways to mitigate the risk and flatten the curve. We have a robust resource center at kdheks.gov with guidance, resources, and daily updates. You can also call the KDHE hotline 1-800-KDHE-INF or 1-866-534-3463. While the recommendations on mass gatherings and social distancing represent a dramatic change from what we're accustomed to, I know Kansans will rise to the occasion. Let's all do our part to protect ourselves, our families, our friends, and our neighbors. Be careful and stay well. Now I'll hand it over to Secretary, Kansas Department of Health and Environment, Lee Norman.
Thank you, Governor. We've had a busy weekend, and we're having busy weeks ahead, I assure you. We have now, as of last night, a total of 11 positive coronavirus patients in the state of Kansas. We picked up 3 new positive patients last night. We have 234 negative tests that we've run. So the rate of positive tests is about 4.7%. The troublesome thing about last night, and it dovetails nicely into what the governor just talked about, is that these 3 most recent positive test results were all people that were exposed to one other Johnson County person that was identified last week who had been to a social gathering while not feeling well, and now these 3 people have come down ill with it. I'm not going to say anything more than that out of the interest of privacy of all involved, but it is a reminder to all of us that we are giving these messages because they are critically important to incorporate into our daily lives. The good news from Wyandotte County was that we've finished testing between 80 and 90 of the staff at the nursing home that you'd heard mentioned before, and all of those people came back with negative test results, which is really terrific news. It's also a testimony, I will say, given that they had a positive patient there in the skilled nursing facility, that they to be negative like that, they had to have been attentive to the principles of infection control, and kudos to them. They were very pleased with the information, as was Providence Hospital, of course, who was in receipt of the patient that ultimately died. I spent Saturday out of our the Kansas Department of Health and Environment lab, and it was with the purpose of really seeing firsthand and interact with our staff out there. I can tell you our people are working very hard. We what started off, remember we talked even as recently as a week or so ago, 7-10 tests a day, and now we're in the 150 to 200 tests per day range with the same number of people. The number of test kits are enough for now. Good news about that is, excuse me, that the commercial labs are coming online, Quest, LabCorp, ViraCorp in Blue Springs, Missouri, and others that will allow for the spreading of the wealth and having the commercial labs do some of the testing. So we are still going to be looking at making sure that all the geographic regions of the state have access to coronavirus testing, but I feel like with the commercial labs coming on, that'll increase our reach, and that it will also help to protect our inventories, quite honestly, of both the swabs that are used to procure the sample from the patients that goes into the viral transport medium, because that's been running short, and then the test kit itself that's run in the laboratory. I also assisted in the training up of our staff that have been going out with protective equipment and teaching them how to wear masks, collect the samples and that kind of thing. That's my job as a state health officer, among other things, to make sure that our own staff are safe, they're trained up, and ready to do that kind of work. So, avoiding the mass gatherings, Governor has really been terrific to work with on this, and you can see why when I use that one example from Johnson County. This is not just a theory. This is very real, and to follow these recommendations. Stay home if you're sick, and remember, ultimately, it's not just about you. It's about the people around you, people you don't know, the people you love. So heed those warnings. Last comment, the Governor mentioned the kdhe.ks.gov website. We're updating it all the time. If your note-taking wasn't scurrying along quite fast enough, you can find the letter of the law as written in the KDHE website toolkit and online resources. I will say that our phone lines have been swamped. We not only have the KDHE hotline for answering questions. That was always originally intended to be for professionals that are calling in that want advice on disease preparedness and the like. It's been flooded with public calls. We've had during normal business hours during the week and some on weekends, we've had where people could call into a phone bank, which has been busy as well. One thing I would say is that it's really encouraging for people to go to the website, because so many of the things that we are getting calls about are the things that are right there in front of them, easily accessed. So that's the end of my comments. I'm sure to stand for questions.
Governor, can you clarify this 50-person limit? Does that apply to the schools, and maybe in a few weeks the schools coming back together and having classes, or does that not apply to them?
We have been working with the State Board of Education on that issue, and when prior to actually requiring them to be closed this week, we did set some guidelines there that there could be no more than 30 kids in a class at any time, and generally there's fewer than that anyway, and that they needed to implement social distancing within the classroom. And then also we had some guidelines for larger groups like band or gym that might be in larger areas. We will be revisiting those guidelines as we go forward. This really is all evolving, and we will remain vigilant and update suggestions, recommendations, or executive orders as necessary.
Governor, how long does the ban on large gatherings last?
I believe the CDC came down with 8 weeks.
That's true. And so this would affect concerts, plays, movies, churches?
Right. Any place where 50 or more than 50 could congregate, it will be up to the venue to ensure that there are no more than 50 in there at a time.
So restaurants, as long as they stay under that 50, as far as you're
I
concerned?
think there are a lot of things that restaurants can do to meet both the demand and their need to pay their employees. And I know that a lot of restaurants, both here in the state and certainly statewide, are starting to do sort of your grab and go. So you drive up, they deliver it to you, and you take it home. So we'll be talking with the hospitality industry later this afternoon, and if necessary, we'll issue some very specific guidelines for the restaurants. But right now, I think a lot of them are self-regulating.
Governor and Secretary, how, maybe this is the wrong word, but how will you enforce this? Or will you enforce it?
I'm going to let you take that one since you've done this before.
We would like to believe that people will voluntarily step up and do that. We and I and the governor and the adjutant general have the ability to enforce that with law enforcement if necessary. Now, that is obviously draconian. It would be well down the road. Everything will be done in consultation and moral suasion. I'd like to think that we can provide evidence, because one of the things that we base, those guidelines are not just pulled out of thin air. They are out of guidance from CDC based on the principles of distancing people, and that's research-based, but we'd like to think that that would carry the day.
But hypothetical, what if somebody calls your office and says, there's this ban on gatherings of 50 or more, and they report something that is obviously in violation of this gathering? Will you dispatch the local sheriff, the local public health?
It would be local law enforcement.
What about the State House, the Senate, and the House of Representatives?
I'd like them to wrap up their work and go home, and then it'll be a moot issue. But I think what you see is, in committee rooms and those kinds of places, we need to make sure that we're not violating these particular guidelines.
For either of you, I'm curious, the kind of the evolution of this, as you've mentioned, has been so fast, and it seems like every day there's basically new guidance or new advice. And I'm curious how, if you're a member of the public and it seems like every day you're hearing a different message, and how do you kind of either combat that or combat the possibility of public confusion? And is there a risk that in having so many different messages that people start to either tune it out or they don't know quite what to believe?
Well, I know exactly what you're talking about because I follow social media, and there's all sorts of information out there, some of which is valid and some of which is not. I think we are doing the best we can to get the message out, to make it very clear and to be very And I do think that the KDHE website is a consistent source of good information. And I would recommend to Kansans that if they have a question about what's in place, what should they do, they ought to go there and take a look. Will we continue to have these kinds of press conferences and information sharing? Absolutely, because things are going to continue to evolve. I don't think that we are finished putting in place strategies to deal with the fallout from the coronavirus.
If you do hear of people who are saying, and there is this chatter out there on social media and elsewhere, that there's an overreaction to this is way beyond the pale, what do either one of you have to say to somebody who would assert that?
Well, we get criticized for being too reactive and not reactive enough. When it comes to schools, I'm probably getting more mail about why don't we just close down schools completely and go home for the year. That's probably the more consistent theme. I think that the best we do. Oh, let me start, and it's to your original question, then Jim. It's called a novel virus for a reason, and that is it's novel. When you look at routine things, you can manage them through the routines that have been long in place. Public health practices and principles, for example, have been around hundreds of years. But this is a novel virus where really, even from China watching, from Europe watching, and now U.S. watching, we're learning best practices. Matter of fact, we have a whole line of effort in my agency, line of effort that is best practices research, because there's things emanating every day. And I think the best we do, quite honestly, is consistent messaging, not hiding behind a closed door, being out in front, and putting the best quality information in a very consistent manner. And Jim, what was your question? I forgot.
What directly would you have to say for somebody who would look at you and say, you're way overreacting to this, you're asking us to do things that aren't warranted? I mean, there is that talk out there. People still
I think the best that we can do is consistent messaging and tell them why we're doing what we're doing, and not just say, trust me, I'm a doctor. That doesn't go very far.
Is there a...
Wait, if I could just add a little bit to that, and I won't say, trust me, I'm a politician either. So, but I think we have decided. I think we talked about this the other day, that we want to take a Kansas-specific response to this. Kansas is really different than, say, Seattle, Washington, or Washington, D.C., or New York. Our geography, our population density, those kinds of things are different. So we are really trying, as we're meeting on a more than daily basis, to figure out what we need to do, if anything, to mitigate this. We are looking at it with data that's in front of us, and with knowing Kansas and knowing what would work here, what is needed here. So we're doing everything as thoughtfully as we possibly can, not taking drastic action just to take drastic action. When we take action, it's because we've been looking at the facts and we know that we need to do it.
Governor, is the state getting what it needs from the federal government in terms of testing supplies, in terms of medical supplies, in terms of support? Is there anything you're concerned about, anything lacking from the federal government?
I'm going to turn that one over to Dr. Norman, but I can say from my perspective, things have gotten a lot better. I think the work at the national level is more coordinated and more responsive. But let me take it down to Dr. Norman, because he would know more specifically about some of those issues.
To the governor's point, I think we've been hearing a lot of good kind of directions from the federal government. Now, $8.3 billion, that is not in our coffers here to work with yet, but I have faith that it will be here. I know the vice president, working with 3M and a bunch of other companies, have really stoked the production pipeline for personal protective equipment, laboratory test kits, and the like. It's building up. We haven't seen a lot of the materials come in the door yet, but I have faith that we're there. And I think, especially with these emergency use authorizations from the FDA to allow these lab testing companies to come on. That's a push from the federal government that has allowed that to be expedited. That alone will take the pressure off of the test kits and swabs that I mentioned earlier. So.
Yesterday, the president, vice president, Admiral Gerard, et cetera, talked about bringing in the high-speed tests this week and the drive-through, walk-through testing centers. Are we getting any of those here in Kansas?
We don't have, oh, yes, there we go. That's the answer. We have not stood those up yet as an agency. KU, and I was talking with the CEO at Ascension Via Christi in Wichita, both have essentially drive-through clinics or drive-through testing sites. KU, as of noon today, has started to use ViraCore, which is a Blue Springs, Missouri based. So those kind of things, one, will take a lot of pressure off of us to be doing all that laboratory testing. And I still think that the same testing, we've always had good testing guidelines, and you've heard me say this before, there's no need to test well people, but we want to lower the barriers to testing people that are ill and might have it. And I think everything we do like this makes it easier. There are certain things being talked about in the insurance industry that would make it easier for people to access care. Anything we can do to make it easier for people to be tested and, when they're ill will be of benefit for containing this.
Why does KDHE relying on individual counties to give information about positive tests? Franklin County, for example, apparently people there are having a hard time getting information that was a travel-related case and not community spread. Why isn't KDHE just communicating that in kind of a uniform way?
Well, public health is local, and the local health departments and the local health officials are the ones that have the obligation to manage those counties. And we feel it's best because they're the ones that we communicate with. They know the lay of the land, if you will, the best. I wasn't aware that there was any problem in Franklin County, and we are happy to assist.
But they're telling you the circumstances, and you could relay that information if you chose to, correct?
Yeah, so there's no barrier to doing that. And by the way, to the earlier question about resources, one of the things that will happen is that the money that comes to us, a lot of that will be pushed out to the local agencies as well. They're underfunded. They've been underfunded for years. And that will allow them to have the staff aboard. You know, some counties only have 2 people in their health departments, and it's really important that there's a lot of capabilities. I call it metaphorically as close to the bedside as possible. And then they're the closest to the patients. They know the lay of the land. They're best.
Dr. Norman, how many ventilators does Kansas have? How many are in use, and do you feel like you have enough?
I don't know the total number. I can have that the next time we get together. We have enough right now, both in terms of ventilators, intensive care unit beds, and staff, importantly. There's not been a crush, quite honestly. There's been a few patients on ventilators that had severe illness, but that hasn't been a limiting factor at this point.
Well, you have enough right now, but I guess obviously the expectation is down the road in 2 or 3 weeks as cases escalate, whether that will continue.
If we look at the worst case scenario, there's no question that we do not have enough in service right now. We would need to go to both our state stockpile and the federal, the national strategic stockpile. And if we're having this problem in Kansas that has 1% of the population, I assure you that it's going to be a much broader problem than that.
Could you provide that at the next briefing, though? Ventilators, isolation rooms, intensive care units, just so we have an inventory.
Question?
For employers over 50 that are still working, are those workers at more risk? Are you advising them to shut down, anything like that? Well,
we are, again, trying to inculcate the principles of social distancing, hand washing and cleaning the environment, et cetera. I think that people are safe if they really embody those principles. So we're not being heavy-handed about going to insert and looking at every single work site, for example, and working from home and looking at continuity of operations procedures. And we have a lot of people working from home. Of course, a lot of them have kids at home now that aren't in school. So both between working from home and the principles that we've got in place, we think that'll carry the day.
I hate to talk about this, but if there's somebody who works for an organization that isn't following any of those guidelines and they're upset about it, can they call you and say, hey, the person I work for is just not taking any of this seriously?
Yes, they can call us and we can have those discussions.
If I could about mingling with one another. If you've got 50 people in the Capitol, but they're all dispersed among other places, I don't believe that's what we're talking about. So I think there would be some common sense applied here.
Yeah, but Governor, on the House floor, there are 125, 150 people when you throw in staff, and they sit cheek to jowl at those desks. I mean, that would be an obvious instance of a gathering of more than 50.
Well, I hope that they will use these new guidelines to get their work done and go home.
All right, thank you.
Thank you.